only do we have a digital divide where some members may not have high-speed Wi-Fi, even those members that have cell phones in certain areas,
True.
we know that we know all about those drop zones.
Yeah.
So one of the ways that we try to address this is by engaging our membership in as many ways as possible, whether that be through a hardline telephone call, whether that be through text messaging if people have cell phones, whether that be email if they do have um, internet access at home, whether it be
Yes.
snail mail if we need to,
Sure.
right? And I can give you a specific example of one of the things that I think that we do that could help to close the gap. So for our members that have high blood pressure,
Yeah.
we actually have a program where we can actually send out a blood pressure cuff to their home, and if they have a smartphone,
Yeah.
they're able to interface that blood pressure cuff with their smartphone
Hey,
in order to be able to
that
to
helps.
to send information back and forth. So that's one of the just an example of something that we do to help with some sort of the chronic illnesses that we have.
Yep.
You know, for those women who don't have an OB provider right there in their community, we do have what's called a doula program, and a doula is someone that is specially trained to kind of help a pregnant mother get
Mhm.
through their pregnancy. And so we have doulas that can go out and access that. So what we really try to do is, no matter what the condition is, we really try to identify the barriers
Yeah.
and to try to overcome those barriers with as many programs and as many add-ons as possible.
So our goal every week is to, dive into topics, but as the weeks continue to compound, we cover a vast array of detail, right? And information for folks to create this holistic understanding of wellness and health outcomes, but more importantly, to drive some of those outcomes, to create the awareness and put the resources at arm's length for folks. As you think about some of these peripherals that are a part of social determinants of health, Doc,
Mhm.
how do the lack of them unfortunately drive poor health outcomes?
Um, so I think all of those things are critical, maybe even more critical than the direct care a lot of the times, because that
Yes,
is truly the bottom line issue,
yes,
right? The
it is.
the issue is not the healthcare itself, is the issue is that I can't access the
Yep,
healthcare
yep.
that I need.